Benign prostatic hyperplasia, BPH, is a common condition in aging men, characterized by the enlargement of the prostate gland. The prostate, a small gland part of the male reproductive system, surrounds the urethra, the tube that carries urine out of the body. As men age, it's normal for the prostate to gradually enlarge, potentially leading to BPH. Though not cancerous, BPH can significantly affect quality of life by causing uncomfortable urinary symptoms. The exact cause of BPH is not fully understood, but it's generally linked to hormonal changes as men age. Throughout life, men produce testosterone and small amounts of estrogen. As they age, the balance of these hormones shifts, possibly leading to prostate enlargement. The main factors associated with BPH include aging. BPH is rare before age 40, but about 50% of men experience it by age 60, and around 90% by age 85. Hormonal changes. An imbalance in sex hormones, particularly an increase in estrogen relative to testosterone, might contribute. Family history. Genetics can increase the likelihood of BPH. Lifestyle factors. Obesity, physical inactivity, and certain dietary choices can increase the risk of developing BPH. Symptoms of BPH. An enlarged prostate presses on the urethra, affecting normal urine flow and causing a range of urinary symptoms, known as lower urinary tract symptoms, LUTS. Common symptoms of BPH include frequent urination, often noticeable at night, known as nocturia, urgency, sudden, intense need to urinate, weak urine stream, due to urethral narrowing, difficulty starting urination, straining or hesitation at the start of urination, incomplete emptying, the feeling of not fully emptying the bladder, urinary retention, in severe cases, an inability to urinate, which can be painful and may require medical attention. These symptoms can range from mild to severe, and if left untreated, BPH may lead to complications, such as urinary tract infections, bladder stones, or even kidney damage. Diagnosis of BPH. Diagnosis typically starts with a review of symptoms and medical history, followed by a physical examination. Key diagnostic steps include digital rectal exam, DRE. A doctor manually examines the prostate through the rectal wall to assess size and shape. Urine tests, to rule out infections or other conditions. Prostate-specific antigen, PSA, blood test. PSA levels can be elevated in men with BPH, although this test is not exclusively diagnostic for BPH. Imaging tests, ultrasound or MRI may be used to visualize the prostate. Uroflowmetry measures the rate of urine flow, which can help assess the severity of blockage. Post-void residual volume test determines how much urine remains in the bladder after urination, indicating incomplete emptying. These tests allow doctors to confirm BPH and determine the severity to guide treatment. Treatment options for BPH. Treatment for BPH depends on symptom severity, patient health, and lifestyle impact. Options range from lifestyle modifications and medications to minimally invasive procedures and surgery. Here's a breakdown. Lifestyle modifications. Reducing caffeine and alcohol intake. Bladder training techniques. Maintaining a healthy weight and staying physically active. Medications. Alpha blockers, such as tamsulosin, relax the muscle fibers in the prostate and bladder neck, easing urine flow. 5-alpha reductase inhibitors, like finasteride, work by shrinking the prostate over time by reducing hormone levels. Combination therapy. Sometimes both types of drugs are prescribed together for enhanced effectiveness. Minimally invasive procedures. Transurethral resection of the prostate, TURP, removes parts of the prostate. Prostatic urethral lift, PUL, implants to hold prostate tissue away from the urethra. Laser therapy vaporizes or removes obstructive tissue with precision. Surgical options. In severe cases, surgery may be recommended. Open prostatectomy for very large prostates. Robot-assisted surgery, a newer technique offering faster recovery. Other emerging therapies. Water vapor therapy uses steam to reduce prostate tissue. High-intensity focused ultrasound, HIFU non-invasive, uses heat to destroy excess prostate tissue, prognosis, and living with BPH. With proper treatment, most men find relief from BPH symptoms and maintain a high quality of life. Early management of symptoms can prevent complications, and newer therapies offer effective relief with fewer side effects than traditional surgery. Living well with BPH, self-care and monitoring. For men diagnosed with BPH, incorporating specific self-care practices can help manage symptoms and improve quality of life. Regular monitoring and lifestyle adjustments can often make a significant difference. Here are some practical steps for managing BPH symptoms daily. Stay hydrated, but time it right. Drink adequate water throughout the day to avoid dehydration, but reduce fluid intake in the evening to minimize nighttime urination. Avoid bladder irritants. Certain foods and drinks can worsen BPH symptoms, such as caffeine, alcohol, spicy foods, and artificial sweeteners. Identifying and minimizing these triggers can provide relief. Regular exercise. Physical activity, especially aerobic exercises like walking or swimming, can help improve overall prostate health and may reduce BPH symptoms. Pelvic floor exercises, Kegel exercises, can strengthen the muscles that control urination. Healthy diet. Eating a balanced diet rich in fruits, vegetables, and healthy fats, such as those in fish and nuts, is linked to better prostate health. Some studies suggest that a diet high in red and processed meats may increase the risk of BPH, so moderation is key. Bladder training. Practicing delayed voiding, where you gradually increase the time between bathroom trips, can help improve bladder control over time. Stay warm. Cold weather can aggravate BPH symptoms. Keeping warm may help to prevent sudden urges to urinate, especially when outside during colder months. Importance of regular monitoring. Even if symptoms are mild or manageable, regular follow-ups with a healthcare provider are essential for anyone diagnosed with BPH. Monitoring helps in several ways. Symptom tracking. Symptoms can gradually worsen over time, so tracking and reporting any changes to your doctor allows for timely adjustments in treatment. Preventing complications. Early detection of complications, such as urinary retention or bladder stones, can prevent more serious health issues. Assessing treatment effectiveness. Routine checkups help assess whether a current treatment plan is effective or if adjustments are needed. When to seek immediate medical attention. Although BPH is generally manageable, certain symptoms require prompt medical attention. Seek immediate help if you experience inability to urinate. Known as acute urinary retention, this is a medical emergency that can cause severe pain and potential kidney damage if untreated. Blood in the urine. Hematuria can signal other underlying conditions, and a doctor should evaluate it. Severe pain in the lower abdomen or urinary tract. This can indicate infection, bladder stones, or complications requiring urgent care. The psychological impact of BPH. Living with BPH symptoms, especially if severe, can affect mental and emotional well-being. Many men experience frustration or embarrassment about frequent bathroom trips or disruptions to daily life. Open communication with family, friends, and healthcare providers can help ease these concerns. Joining a support group, either online or in person, can provide valuable information and emotional support by connecting men facing similar challenges. Looking to the future. Advances in BPH treatment. Research in BPH is ongoing, and the future looks promising with several emerging therapies. Some of the latest innovations include MRI-guided focused ultrasound, a non-invasive approach that uses MRI technology to target and shrink specific prostate tissue without surgery. New medications. Researchers are developing drugs with fewer side effects that specifically target the hormones and growth factors involved in prostate enlargement. Genetic testing and personalized medicine. Understanding individual genetic profiles may soon allow for more personalized treatments tailored to each man's specific risk factors and genetic makeup, proactive approaches, and preventive measures for BPH. While BPH is a common part of aging, especially in men over 50, adopting certain proactive lifestyle practices may help reduce the risk of BPH or alleviate symptoms if they do occur. Although BPH itself may not always be preventable, Men can take steps to support overall prostate health and improve urinary function. Point 1. Prioritizing a prostate-friendly diet. Research suggests that certain nutrients and dietary patterns are associated with better prostate health. High fiber intake. Consuming plenty of fiber from whole grains, fruits, and vegetables supports digestive health and can prevent constipation, which may otherwise put pressure on the bladder and exacerbate urinary symptoms. Antioxidant-rich foods. Foods high in antioxidants, particularly lycopene, found in tomatoes, and vitamin E, have shown benefits for prostate health. Healthy fats. Opt for sources of healthy fats like olive oil, avocados, and omega-3 rich fish, as they may help reduce inflammation. Staying physically active. Regular physical activity is linked to reduced risk of BPH and lower urinary tract symptoms. Exercise helps reduce inflammation. Physical activity reduces inflammation, a factor that could play a role in prostate enlargement. Balance hormones. Exercise supports balanced hormone levels, which may prevent the hormone-driven growth associated with BPH. Improve urinary function. Strengthening core muscles, including the pelvic floor, through exercises such as Kegels can help improve bladder control. Point 3. Managing stress. Chronic stress can contribute to various health issues, including BPH, by influencing hormone levels and inflammation in the body. Techniques for managing stress include mindfulness and meditation. These can help regulate stress levels and improve overall emotional well-being. Deep breathing exercises. Simple breathing techniques can be effective for stress management and can be practiced anywhere. Point 4. Avoiding overuse of certain medications. Some medications, particularly decongestants and antihistamines, can aggravate BPH symptoms by tightening the muscles around the prostate and bladder neck, making it harder to urinate. Men with BPH should consult their healthcare provider before using these medications and discuss alternatives if necessary. 5. Regular check UPS and proactive screenings. While BPH is not cancerous, men should monitor their prostate health as they age. Proactive screenings, such as prostate-specific antigen, PSA, tests and digital rectal exams, DRE, allow early detection of prostate conditions, including BPH and other potential concerns like prostate cancer. Lifestyle and community support for men with BPH. Living with BPH can be challenging, but a strong support system can make a significant difference in managing the condition. Here are some ways men with BPH can benefit from community and family support. Family involvement. Openly discussing symptoms with family members can foster understanding and support. Family members can help manage lifestyle adjustments, such as meal planning, to accommodate dietary needs. Support groups. Many men find comfort and practical advice by joining support groups where they can share experiences and tips for managing BPH. These can be found online or in local community centers. Educational resources. Being informed about BPH can empower men to take control of their health. Many reputable health organizations provide resources that help men understand BPH, available treatments, and lifestyle adjustments to improve quality of life. Future perspectives in BPH management and research. Ongoing research and technological advancements continue to improve BPH diagnosis, treatment, and prevention strategies. Here are some of the exciting areas of research in BPH. Biomarkers for precision diagnosis. Identifying specific biomarkers associated with BPH could lead to more precise and individualized treatment plans, minimizing side effects and improving effectiveness. Non-invasive imaging. New imaging technologies are being developed to provide detailed views of the prostate with minimal discomfort, allowing for earlier detection of changes that might indicate BPH or other prostate issues. Gene therapy. Though still in the early stages, gene therapy holds potential for addressing the root causes of BPH at the cellular level, possibly offering a more permanent solution. Telemedicine and remote monitoring. Telemedicine is making it easier for men, especially those in remote areas, to access consultations and follow-ups with specialists, which can be essential for ongoing BPH management. BPH, while a natural part of aging for many men, doesn't have to dictate quality of life. Through awareness, proactive lifestyle choices, and seeking appropriate medical care, men can effectively manage and mitigate the impact of BPH on their daily lives. Regular communication with healthcare providers, staying informed about new treatment options, and fostering a strong support system are key elements in living well with BPH. With advancements in medical research and a deeper understanding of the condition, men with BPH can look forward to more effective, less invasive treatments and, ultimately, a better quality of life as they age, self-monitoring and tracking progress. For men managing BPH, keeping track of symptoms can be very useful in understanding how well treatments or lifestyle adjustments are working. This involves symptom diary, recording the frequency and severity of symptoms, such as nighttime urination, urgency, or flow issues. By documenting these details, men can better communicate changes to their healthcare provider. Urine flow tracking, noting any changes in urine flow strength, frequency, or the sensation of incomplete emptying can indicate how well treatments are working. Medication effects, observing any side effects from medications and how they impact daily activities. Reporting these to a doctor can help adjust dosages or explore alternative options. Lifestyle changes, tracking any dietary or exercise changes to see if they correlate with symptom improvements. For example, noting if avoiding caffeine or doing regular Kegel exercises has helped. Routine follow-ups and adjusting treatment. Regular follow-up appointments are essential for anyone with BPH. These visits allow doctors to assess symptom progression. Doctors can evaluate any worsening of symptoms and recommend timely interventions. Monitor for complications. Early detection of potential complications, such as bladder stones or kidney issues, can prevent more serious health concerns. Adjust treatment plans. Depending on progress, a healthcare provider might suggest modifications in medication, changes in lifestyle recommendations, or discuss minimally invasive options if necessary. The frequency of follow-ups will vary depending on symptom severity, age, and overall health, but generally, annual checkups are advisable for most men with BPH. Outlook on living a full life with BPH. Though BPH can be uncomfortable, it is a manageable condition, especially with a proactive approach to treatment and lifestyle. Men with BPH can focus on building a balanced life that includes engaging in social and physical activities. Staying active and socially connected not only supports physical health but also reduces stress and improves mental well-being. Continuing to learn about prostate health. Staying informed about BPH and understanding all treatment options helps in making empowered health decisions. Setting realistic expectations. Acknowledging that BPH is a chronic condition that may require ongoing management can help set a mindset of adaptability rather than frustration. Managing BPH can be challenging at times, but men don't have to face it alone. With advancements in medicine and a wide range of effective treatments, BPH symptoms can often be controlled, allowing men to lead active, fulfilling lives. Through a combination of medical support, healthy habits, and self-monitoring, men can manage BPH effectively and maintain a high quality of life well into their later years. Above all, it's about taking small, consistent steps towards better health and remaining connected with healthcare providers to optimize treatment. A proactive approach helps ensure that BPH, while a natural part of aging for many men, doesn't become an overwhelming aspect of life. Mental and emotional well-being in BPH management. BPH can impact mental and emotional health due to frequent disruptions and frustrations from urinary symptoms. It's common to feel annoyed or even embarrassed by the condition, but focusing on mental well-being can greatly improve the experience of managing BPH. Here are some helpful approaches. Stress reduction techniques. Techniques like meditation, deep breathing, and mindfulness can reduce overall stress and help men cope with BPH symptoms. Seeking support. Whether through family, friends, or support groups, talking about the experience can relieve feelings of isolation and provide practical advice. Counseling or therapy. For men who find the impact of BPH on daily life particularly challenging, talking with a counselor or therapist can help with coping strategies and emotional resilience. Building a strong mental foundation and seeking support can improve one's outlook on living with BPH and foster a more positive attitude toward daily management. Staying proactive with overall health. In addition to directly managing BPH symptoms, Staying proactive with general health can have indirect benefits, reducing the overall impact of BPH on daily life. Here are some preventive health measures to consider. Routine physical exams. Regular health checkups can identify other health conditions early, such as diabetes or high blood pressure, which may exacerbate urinary symptoms. Maintaining a healthy weight. Excess weight can put extra pressure on the bladder, worsening symptoms. A balanced diet and regular exercise can make a significant difference. Good sleep hygiene. Quality sleep can be challenging with nocturia, frequent nighttime urination, so practicing good sleep habits, such as limiting liquids in the evening, avoiding caffeine late in the day, and creating a calming nighttime routine, can help improve sleep quality. Alcohol moderation. Alcohol can irritate the bladder and increase the frequency of urination. Reducing or moderating alcohol intake can help manage BPH symptoms. Taking care of overall health supports prostate health and can improve comfort and energy levels, helping men with BPH stay active and engaged in life. Daily tips for comfort and symptom management. For men with BPH, small changes in daily routines can provide a lot of relief. Here are a few practical tips for better symptom management. Bathroom planning. Planning bathroom breaks before long trips or meetings can prevent discomfort. Knowing where restrooms are located when out in public can also help ease anxiety. Dressing for convenience. Wear clothing that's easy to adjust, especially for men experiencing frequent urges to urinate, so trips to the bathroom are faster and easier. Drinking enough water. Although it's important not to overdrink, staying adequately hydrated, especially earlier in the day, prevents concentrated urine, which can irritate the bladder. Avoid holding urine. Holding urine for too long can strain the bladder. Try to use the bathroom as needed to reduce pressure. These simple adjustments can enhance comfort and help manage symptoms, making day-to-day life more enjoyable and less impacted by BPH. Living with BPH requires a blend of medical treatment, lifestyle adjustments, and mental resilience. By staying informed, proactive, and attentive to health, men can maintain a high quality of life, even with the challenges of BPH. With ongoing research, new treatments, and a deeper understanding of the condition, there are more ways than ever to effectively manage BPH. Staying connected with healthcare providers, prioritizing well-being, and making small, manageable changes can collectively support a fulfilling and active life despite BPH symptoms. Each step taken, no matter how small, brings more comfort, control, and confidence in managing BPH for a balanced, healthy life, cultivating a positive mindset and managing expectations. Adjusting to life with BPH can feel overwhelming at first, but focusing on a positive mindset and realistic expectations can help manage the condition more smoothly. Here are some strategies. Set realistic goals. Improvement with BPH is often gradual, so setting small, achievable goals, such as reducing nighttime urination by 1 trip or increasing exercise frequency, can make progress feel more attainable. Celebrate small victories. Each positive change, such as sleeping better or experiencing fewer symptoms after a new treatment, is worth acknowledging. Celebrating these moments can boost motivation and remind men of the progress made. Stay informed and empowered. Learning about BPH and its treatments helps men make informed choices and reduces uncertainty. Knowledge empowers men to discuss options with healthcare providers confidently and stay proactive in managing their health. Embrace adaptability. Adapting to new routines, whether it's dietary adjustments or a regular exercise plan, can take time. Staying flexible and open to making small changes helps men gradually incorporate beneficial habits without feeling overwhelmed. Medication routine. If prescribed medication, taking it at the same time every day ensures steady levels in the body, which may enhance effectiveness. Exercise and physical activity. Engaging in daily or weekly exercise helps maintain both physical and mental well-being, reducing stress and improving urinary function.